your house, because 7:30 it gets hotter, at least now, because I mean from 7:30 sometimes you can have 40 degrees. So, but it's important to at least have a little sun. It might not be every day, but at least every other day.
Okay, but with sunscreen.
Yes, you can use your sunscreen. Yes.
Okay, all right. Then my very last question. You mentioned that one of these tests reveal allergies. I personally have noticed some allergies that I have. For instance, I think I've noticed that I'm lactose intolerant and I'm also reactive to gluten. But these did not come from any form of testing.
Okay.
I noticed it over time and from research. So now, are you saying that there are some tests that can actually reveal and maybe possibly correct the effects of these things?
Okay, so for lactose intolerance and gluten, that's different. Yeah. So what I mean by allergies are simple allergies like excessive sneezing and all that, and especially patients who have a family history of hay fever and asthma. So there's something we call eosinophils that is in your full blood count that will show us if you're tending towards that. Now for lactose intolerance, the truth is it's a diagnosis of exclusion. So we remove all the causes as we're doing the test. I was like, okay, this might be the cause. Take out milk and let's see. For gluten, there's a specialized test for that. We'll tell you to take the gluten, do that test to see if it's there. And then when we find it, we'll tell you to stop the gluten. Okay? The cure, not yet. So, but we tell you to avoid anything that. So, I am lactose intolerant, so I don't drink. What I do is plant milk. So your coconut milk, your almond milk, they're expensive, but the coconut milk you can make yourself. That's the truth. So you don't have to buy it. You just blend it and then squeeze it out, and then you have your own milk that you can use. Yeah. So you just have to be deliberate about it. Yeah. Yeah.
Thank you so much, Doctor. But I want to ask these questions about what you explain about the breast checkup. That you said you can do some kind of maybe practical work by yourself by placing hand behind your head and placing the other hand around your, the other side of the breast to check. So I want to understand what are the signs you will get to know if you're okay or you're not okay. So what's the sign? What's that thing that will tell you that, okay, it's better? It's not.
Okay.
Thank you.
So as you're checking your breast, when you look at your breast, before you do the checks, when you look in the mirror, if you see that your nipple is distorted, this is not how my nipple has been before. Maybe it's inside instead of outside, or maybe it's distorted to the right or distorted to the left, then you know that this is not how it was before. So you need to go and get checked. Yes? If you see an unusual rash, right, around the nipple area, you need to go and get checked. If you see an ulcer, like a boil that just keeps coming up on that part, you need to go and get checked. So that's looking. Yeah? Now for feeling, you need to check if you feel any lump at all, any lump, even if it's like an orange seed, you still need to go and get checked. Okay? And the truth is, if you feel anything unusual, whether it's in your mind or it's not, it's better to be safe than sorry. Please go and get checked.
I want to also ask about the blood counts you talk about. When you go for a checkup for blood counts, I want to know what are the things you should know about the blood count. What. I just want to understand what kind of a result or what we should be expecting when you check your blood count and all that.
Okay. So when you're doing your full blood count, so in the full blood count result, I'm just picturing it in my head. You have your PCV. Your PCV is your packed cell volume. That's how much blood you have in your body, right? And then you have your hemoglobin. It's part of the PCV. We'll show you.
Sorry, I didn't hear that.
Hemoglobin. Yeah. So in the blood count, you have it as HB. Okay. So it will show you. So for women, especially women who are menstruating just before menopause, you should be having a hemoglobin of between 10.5 to 11.5. It's usually lower than a man or a woman in menopausal age. So that's PCV of between 32 and possibly 36. Yeah. So, but if you're lower than 32, say you are anemic. Okay.
Thank you
so that, Is that all you want to know?
Actually, I was going to ask
Okay.
one more last one. The
Okay.
one they call what's it called, cholesterol.
Yes.
The cholesterol, is it as a result of too much of carbohydrate or?
Okay. So cholesterol is also when we take, so there's good cholesterol and there's bad cholesterol. So you have the total cholesterol, which we check, and then we check the good cholesterol, which is the HDL, and we check the bad cholesterol, which is the LDL. So all these things are found in not just carbs, but your oils, your shaki, your komo, your roundabout. So these ones, they actually make us increase the cholesterol level of our system. So good oils, things are not easy now, but soya oil, which is I think is a bit affordable, is good. But even when we say good oils, some of us are like, okay, good oils, soya oil is good, olive oil is good. Then I will now heap my pot.
How do you know the good oil and the bad oil?
So, oil that gets congealed, you know,
See the
Ororo,
sleepy one and the
Ororo
one that looks
oil.
sleepy, not
It gets, yes, that's it. So you know that that's not very good for you because you can see it is laden with cholesterol. So you have to be careful with those kind of oils. And whatever oil you use, just use a little. You don't have to use so much. Now I'll give you an example of myself. I like plantain. I like dodo. Yeah, and I really don't eat so much like that. But I realized my cholesterol was high. I was like, I use sunflower oil. Which one is this one? But it was the dodo. So I now started, because I was frying and frying and frying. So you know what I did? I stopped frying. I started using an air fryer. I just put it in the air fryer and I used, guess what? In 3 months, my cholesterol dropped. So I was using a good oil, but I was using too much of it. Yeah.
Thank you so much, ma'am. I'm grateful.
Thank you so much, Doctor. Okay, I wanted to ask because a lot of people use traditional medicine like agbo. So agbo is the cure all for everything. You are sick, you have malaria, agbo. Someone has diabetes, high sugar, agbo. So I want to know, is it something we should do? Is it really good for us? What is there a dosage? Is it advisable to ask people or let people take that kind of concussion? Thank you.
Thank you, ma'am. Okay. So, Agbo, please, we have to be careful.